Hi everybody. We are going to do a quick little, audio over Introduction to Psychological Disorders. We already started with this slide in class last time, so take a look at this. If you have any questions, let me know. This is basically showing that we can take a look at disorders from 3 different vantage points. Either saying that we're going to look at them from the idea that there's something with the body that is causing an illness, which would be the medical model. The psychological model is saying that there's something going on with our mind, and the mind is causing the symptoms to come up, or that it's due to the brain, the mind, and the social environment, and those 3 things coming together to produce the different symptoms of the disorder. So take a look at that. If you have any questions on that, certainly let me know. But we are going to move on to diagnostic technique. So diagnostic classification aims to summarize symptoms by providing a label, predicting future behavior, suggesting treatment, and allowing communication, and stimulating research. Okay, so the best parallel I can give you is if you go to the doctor and you tell the doctor that you have a headache and pressure behind your eyes and drainage down your throat and, just a lot of head pressure. What the doctor is probably going to do is summarize your symptoms by providing a label, and that label may be sinus infection. We can predict future behavior, saying that this is going to get worse before it's going to get better. They can suggest treatment. Take this drug and it will reduce your symptoms until your symptoms go away. It allows for communication in a manner that you can go to your coworker and say, I was diagnosed with sinus infection. And they can understand sinus infection. And it can also help stimulate research. So researchers can take a look at the duration of sinus infection. They can take a look at how many people get sinus infection. Okay, so that's using a medical diagnosis. If we switch over to a psychological diagnosis, it's the same thing. We want to diagnose in a way that helps us to summarize symptoms by giving a label of some nature. So if I say depression, you will know what symptoms go along with depression. You can predict future behavior of depression. You can suggest treatment for depression. It allows for communication, and we can also then research depression. Now, depression is not the only thing. We do this for all different diagnoses, but depression is one that many are familiar with. Okay, moving on. The DSM-5 is our current manual that we are using. Please note the longhand version of the DSM. DSM stands for Diagnostic Statistical Manual. We are in version number 5. It has groupings of diagnostic categories. However, in italic print, it does not suggest how to treat. Okay, so if you look in the DSM-5 underneath depression, you will not see any suggestions of how to treat. Why not? Because there are lots of different viewpoints on how to treat different diagnoses. So we will talk about that once we get into therapy, but that's about all that we're going to say on that at this point. International equivalent is the ICD-10. ICD stands for International Classification of Diseases. It's in the 10th edition. And what this is it's another book, but instead of it being, how do I want to say, it's not specific to the United States. The ICD-10 is an international version of different diseases that are listed, and this is something more if you're in the nursing field. You would use the ICD-10 more so in the nursing field than in the psychology field. Psychology, we use the DSM-5, but in the more medical, the hard medical fields, you would see the ICD-10. So that is kind of the parallel to the DSM-5. All right, most prominent disorders. We have 4 of the biggest prominent disorders here, or categories rather. We have anxiety disorders, personality disorders, mood disorders, and schizophrenia. For this exam, we're going to take a look at anxiety disorders, and then for the next exam, we will move on to some of the others, but we just needed to break this up a little bit. So you can see the usage the usage. Oh my goodness, it's a Friday, folks. You can see the diagnosis levels on this little chart below here. So you can see any disorder and the percentage of the population that meets this. Substance use disorder, followed by anxiety disorder, mood disorders, and schizophrenic disorder. All right. There are 4 different anxiety disorders that we are going to talk about. We're going to talk about generalized anxiety disorder, which is GAD, panic disorder, phobias, and obsessive compulsive disorder, also known as OCD. Okay? So anxiety disorders. We're going to start with generalized anxiety disorder. Generalized anxiety disorder is constant, intense anxiety, and it's not towards a particular situation, person, or object. So as it sounds, it is generalized. It's a general anxiety that's not tied to a specific thing. Okay? Of those suffering from GAD, generalized anxiety disorder, 2/3 are women. So we can take a look at that and we can say, looking at the medical model, what does that tell us? We can take a look at the psychological model and see what that might tell us. And we can also take a look at the biopsychosocial model and see if there's something in there as to why women get this more so than men. Okay, so we might talk about that in class. Ponder that. Why might those 3 views, or what might those 3 views tell us about GAD and why it's more prevalent in women? Okay, so GAD, generalized anxiety disorder, it's constant, intense anxiety, and again, it's not tied to something specific. That piece is important. Panic disorder is next. It starts with a panic attack. Panic attack is mild anxiety that suddenly turns into severe panic, increased heart rate, sweating. If you've ever seen somebody have a panic attack or if you've had one yourself, you know it is not pleasant at all. People often report that they feel like they are going to die. Literally, they feel like they're going to die or that they are having a heart attack. So panic attacks are not fun. So panic disorder is going to start with a panic attack. The panic attacks become more frequent, thus becoming panic disorder. So the more panic attacks you have, then you get moved to a label called panic disorder. The fear of the occurrence of a panic attack then happens. So if you think about it, panic attacks they're not fun by any means. And so once you have one panic attack, then you fear that you might have another panic attack. And once you have 2, 3, 4, 5, 6, 10 panic attacks, then you fear the occurrence of the next panic attack. And panic attacks don't come at a certain time or a certain day or a certain trigger. They can come out of the blue. And so imagine if you are sitting in class and you have a panic attack, or you're going to work and you have a panic attack, or you're on a date with a new person and you have a panic attack. So do you see where the fear can come in? So people start fearing the occurrence of a panic attack. Okay, so this is kind of a very brutal cycle if you think about it. You have a panic attack. Panic attacks become more frequent. You start fearing the panic attack. Fearing the panic attack causes more panic attacks, which then feeds into your fear of having a panic attack, which feeds into more panic attacks. So you see how this is like a vicious cycle here. Okay, so once all of this comes into fruition, then you have panic disorder. Smokers are more likely to experience panic attacks, and we can take a look at this and see, is this a medical piece? Is this a psychological piece, or is this a biopsychosocial element? And it could be all 3. So ponder that. Why would smokers be more likely to experience panic attacks? All right, moving on. Our 3rd type of anxiety disorder is phobia. So phobias are irrational fears towards a specific object or situation which interferes with everyday behavior. Okay, so if you have a fear and it doesn't interrupt your daily behavior, then that's not a phobia. And also we realize it's an irrational fear. So if you look at the chart right down here, you can see we have snakes being in high exposed places, mice flying on an airplane. We have spiders, dogs, cats driving in a car. All of these are fears. They're considered irrational fears to the level that people have them. And it's triggered by this specific object or situation. Versus if we go back to GAD, generalized anxiety disorder is general anxiety, but phobia is a fear towards something very specific. So make sure to know the difference between those 2. In class, I will introduce you to Hilda. I believe I have that video still. I will introduce you to Hilda and her fear of snow, but we're going to move on. Here's an entire list. You can pause this if you want to take a look at this. And this doesn't even touch the surface of how many phobias are out there, but there are lots of different types of phobias. You have phobias of numbers, phobias of crowds, people, water, birds, lightning, dogs, hair, insanity, all kinds of things that people have phobias over. Okay, our fourth anxiety disorder is OCD, or obsessive compulsive disorder. Obsessions are repetitive thoughts of dread or concern. Compulsions, on the other hand, are repetitive behaviors, usually tied to the obsession. Okay, so obsession has to do with your thoughts. Compulsions have to do with your behavior. So if we look at the chart down here, we have obsessions, so repetitive thoughts. You can have repetitive thoughts about dirt, germs, or toxins. You can have repetitive thoughts about something terrible happening, so a fire starting, death, illness. Things need to be in order, they need to be exact, they need to be perfect. Those are obsessions because they're repeated thoughts that you struggle with over and over. Compulsions, on the other hand, are repetitive behaviors, so make sure to know the difference again. Compulsions, excessive hand washing, bathing, toothbrushing, grooming, repeated rituals. You have to go in and out of a door a certain number of times until it feels just right. Checking doors, locks, appliances, car brakes, homework. So this is, again, not just checking your door to make sure it's locked, but checking it, because if you don't check it, it's tied to the obsession that something terrible might happen. Somebody's going to break into your house. Okay, so we can take a look at excessive hand washing is tied to the thought or the obsession regarding dirt, germs, and toxins. I have to wash my hands because if I don't wash my hands in such a certain way, then the germs will get in and I will get sick, or my toddler might get incredibly ill, or whatever it may be. They're tied together usually in some manner. So please make sure to know obsessions have to do with thoughts, compulsions have to do with behaviors. One thing I like to point out is people like to throw this around a lot in terms of, oh, I'm so OCD. No, you probably are not. Simply because if you are diagnosed with OCD, it would be interrupting your daily life. So I know a lot of people like their money to face a certain way. It has to, all face in the same direction. And that's okay. It's good to be tidy, right? But it's not OCD unless you have something tied to it and you have a thought that's tied to it in terms of, if I don't face my money in a certain way, then this will happen. Or if I don't do this behavior, then something is going to happen. Okay, so you see it's above and beyond just liking something clean or neat or tidy or organized. Okay, let's move on. You know what? I think we're going to stop there. We're going to stop there for today. That looks like enough for today. So these are the 4 different anxiety disorders. There they are again: generalized anxiety disorder, panic disorder, phobias, obsessive compulsive disorder. Please know how they're different because that's going to help us distinguish them from each other. Know their symptoms because that's going to come into play in about a week or so. All right, I will see you in class. Have a wonderful weekend.